Hello. There were some questions about the regional and directional terms, so I wanted to make a quick video to review those and to clarify the frequently asked questions. So let's go over the ones that generally people are pretty comfortable with, and then we'll end with the ones that people tend to have more questions about. So there are several words that you can use to describe towards the head or towards the top of the organism. These words can be superior, cephalic, cranial, rostral. So all of these terms mean towards the head. People have asked me which one's the correct term or which one's preferred. And for this course, with me, I don't have a preference. So if I ask you for a term that means towards the head and you say cephalic, that is just as good of an answer as if you say rostral. In general, there are different kind of subspecialties that prefer different terms. Neuroscience and developmental biology, embryology, they would tend to use rostral and caudal more for towards the head and towards the feet, whereas like sports science, physical therapy, medicine, I think they tend to use superior, inferior more. So similarly, words that mean away from the head or towards the feet are words like inferior, caudal. I can't think of any others. Those are the two that are used the most. I remember the words in pairs, so I remember that superior is paired with inferior, rostral is paired with caudal. The way I remember rostral versus caudal is rostral rhymes with nostril. Rostral means towards the head. Your nostril is on your head, so rostral, nostril. Similarly, you could use anterior and ventral for meaning towards the front of the body. Either one is correct. You could say dorsal or posterior, meaning away from the body. I'm sorry, towards the back of the body. Either one is correct. The questions I get asked the most are, when is the best time to use proximal and distal? Proximal and distal are special because they only refer to comparisons of body regions that you find on limbs. Okay, so both body regions need to be on a limb. A limb would be either an arm or a leg. So if one of the terms is not on a limb or a place where a limb attaches, for example, if one of the terms is on the head, or if one of the terms is on the trunk, you would not use proximal and distal. You will only use proximal and distal when you're describing the relationship between two body parts on limbs. And you describe the relationship based on which one is closer or further from the attachment point. So where your limb attaches is kind of going to be the comparison point. So if we are comparing my elbow, this is on the anterior side of my body. So this would be the olecranon, antecubitus. Okay, took me a bit. This is the antecubital region. If we're comparing the antecubitus to the brachium, you have to decide which one is closer or nearer to the attachment site. So if you say the antecubitus is blank to the brachium, you have to decide, is the antecubitus further away from the attachment point at the shoulder, or is it closer? So if you decide that it's further away, which it is, then that would be distal. The antecubitus is distal to the brachium. Now, if you were to reverse the order and say the brachium is blank to the antecubitus, you have to decide what's the relationship of the brachium to the attachment point. Is it closer or further? The brachium is what compared to the antecubitus? So in this example, the brachium is closer to the attachment point. So we would use proximal. The brachium is proximal, closer, than the antecubitus, further. Okay, so proximal and distal, only used for terms that you're comparing that you find on limbs. If one or more of the terms is not on a limb, then you should use superior, inferior, or different terms. The last term that people get confused about is intermediate, and that's because intermediate is the oddball. So most of these terms are used when you're comparing two body parts or two regions. However, intermediate is special. You use intermediate when you are comparing three body parts. And the one that is intermediate is the one that is sandwiched in the middle. So, for example, if we think about our skin, and then deep to that is muscle, and then even deeper inside the body to that is bone, and we were describing which layer is intermediate, we would have to pick the one in the middle. So which layer is in the middle? The skin, the muscle, or the bone? The obvious answer is the muscle. The muscle's in the middle, so you would say the muscle is intermediate in the middle of the skin and the bone. The skin is superficial on the outside or towards the surface of the body. The muscle is intermediate, it's in between, and the bone is deep. The bone is deeper inside the body. So to summarize, intermediate is used when you're comparing three or more terms, and intermediate describes the one in the middle. So I hope this helps you guys with your terms and provides a little bit of clarity to you.